this has really stretched us. We didn't have, our tertiary hospitals don't even have the capacities. And if you look at the population of Nigeria and you're comparing it with the number of isolation beds that most state governments are celebrating that they've built, you hear a state celebrating 30-bed isolation center, a 20-bed isolation center, and so on. And that's really a problem to me, because it just shows that we've never been ready for this pandemic. Our public health facilities were non-existent before now.
Okay, so the other day I saw you making fruits.
Yes.
Is that a way to stay healthy?
Well, as a result of this pandemic, when it happened, I needed to know. I went to our local pharmacist here, even to get vitamin C was a problem, because I knew that, okay, I needed to boost my immune system. And if I couldn't get vitamin C's from the pharmacist, what do I do? So I took on to the internet to begin to read on one of the ways to prevent this virus at home. And so that's why I started to go to say, okay, let me change my diet and ensure that I have enough immunity to fight the virus.
Well, Sister Moji, thank you for joining us. You are part of the panelists for tonight, yourself, Dr. Basi, and Dr. Joe Achibong. And I'd like to start or continue from where I have been with Brother Vincent, with you. And possibly I want to start from where we stopped the last time. And my first question to you is that, is this the beginning of self-care globally for everybody?
Thank you very much, Mr. Dennis. Good evening, all. Apologies for joining slightly late. As we all know, a lot of mommy duties calling from left, right, and center. Straight back to your question, is this the era of self-care? We started talking about self-care from last week, and we gave ourselves a definition of what self-care is and what we can engage in, the type of medication and care we can give to ourselves that is within legal permissions, that is that will not, or that is within our capabilities, that will not allow us to run into trouble. I wouldn't say it's the beginning of self-care. We've been practicing self-care in Nigeria for quite some time. From even time immemorial, when even our parents in the village did not have access to contemporary medication like our tablets and our capsules, our parents have been making use of all forms of herbs, taking care of themselves. They know when to rest. They will notice that when they go to the farm, they go very early in the morning, just right before the sun is up and very hot, and we sap them and dehydrate them. They are under a shade resting. They eat. They know, they eat, they rest and eat, and then they go back to the farm, they harvest, and then they go back in the evening and they are resting and they're eating fresh, they're eating well. They know what herbs to mix together to take care of themselves. So that's from time immemorial, we've been practicing self-medication and self-care, even here in Africa and down to Nigeria. Now to contemporary medicines that involves our capsules and our tablets and medications that have been formulated. Yes, it's time to practice self-care. We need to take care of ourselves. Even we are told from the Ministry of Health and in the hospitals that do not go to the hospital until you find out that there is utmost need for you to go to the hospital. And so when they tell you don't come until you find out there is utmost need, there is need to develop ourselves in the area of self-care. And so self-care is the ultimate, self-care is the way to go. We need to know how to take care of ourselves up to that point when we say, okay, I cannot do anymore. I need expert advice. I need to go to the hospital. And so I won't say it's the beginning. It's an ongoing process, or should I say a reopening of the former book that was closed, where we leave all our responsibilities to healthcare practitioners. And we take up responsibilities and we learn, and we need to learn and know how to take care of ourselves. Thank you.
Okay, I want to ask you this question. The other day, I was listening to one of the survivors, and he was talking about ginger and so many things. And I also hear you talk about mixtures in those days. Are we now back to herbal medicines?
Are we back to herbal medicines? I wouldn't say we are back. We've always been there. We've always been taking herbal medicines. This is Africa. And the origins of pharmacy practice, I would say, is from the days where, you know, there were mixtures and people extract medication and extract medicines from herbs. And from all these herbs, that is what is taken to the lab, where we find out, okay, this is the active ingredients, and then it is formulated into capsules and it is well regulated. I think this is the time that we need to go back to our roots and find out and get the best out of our traditional medicine practices. That is our herbal practices. In countries like China, their traditional medicine has been incorporated into their contemporary medicine. And so it's not something new, but that is an area that has not been done yet in Nigeria. I know that under the Federal Ministry of Health, we have a desk for traditional medicine, but not a lot is looked at in that aspect. And so we truly need, it's a wonderful area. It's a vast area where research truly needs, you know, where it needs to be researched. We need to invest into the research of our traditional herbs. We all know that it works. The problem that we're having with herbal medicine is that it is not standardized. They will just tell you, take a cup in the morning, take a cup in the afternoon. What is the measurement of a cup? If I love the taste of the medication, I can take a cup as large as Basia. And then if somebody does not like the taste of the medication, he will take a tiny cup, you know, and just take, and then say, I've taken a cup. And then we also don't know what, there's a lot of secrecy, let me put it that way, of the content of the preparations, because people believe that it is they want to own it. It's their own. They don't want to let go of family secrets, you know, family traditions, and they don't want to let go of it. And so there's still a lot of secrecy. If you come out and tell us, the herbalists or herbal medical practitioners who have come out and say, this is what I put inside this medication, this is what is inside, this is what is inside, and then they write on the body and say, these are the contents, you'll notice that they have NAFDAC numbers. There's some form of recognition. They are registered under the National Agency for Food and Drug Administration and Control. So we need to put in more work. We need to put in more research, because I believe it's an area that would help and profit us a lot. And when I say a lot in Nigeria, because they end up being, they're cheaper. Herbal medications are cheaper than our contemporary medications. And then once we can standardize them and make proper use of them, and they actually do work. We notice that sometimes, I remember there was a time my child had tonsillitis, and we had used all manner and all sorts of antibiotics. We had taken him to the hospital. They had prescribed acting antibiotics, and then it was not getting better. It was a lady in the office who told me that go to the market where we have people that we call elewe omo in Yoruba language. There are people that sell herbs in the market, and pick this, pick that. She told me what to do, and the thing works like magic. The tonsillitis cleared in 2 days. This is tonsillitis that we've been treating for over 2 weeks, and the child was running fever. We had taken him to a pediatrician. They had actually confirmed that it was tonsillitis. They had placed us on antibiotics, and we had used it for a week, and it wasn't getting any better. And this just cleared in 2 days. So I believe it's an area that we need to research into. We are going back to the era of herbal medicines, or should we say we should improve upon our herbal practices. Thank you.
Okay, Dr. Basinya, welcome to the program tonight. And I hope you can hear me. And I want to start with you on the next set of questions. Let me start by asking you, God forbid, if the case goes beyond now, do we have enough facilities to cater for people like we have in Europe and America?
All right, can you hear me?
We can hear you. Go ahead, sir.
Okay, you can hear me, right?
Yes, go ahead. We can hear you.
All right, thank you for having me. With regards to facilities, obviously we are a third world country, developing country, and we don't have enough facilities to be able to cater for this situation if it goes beyond what we are having currently. That we can say categorically.
Okay. So, and I want to ask you some follow-up question. Maybe I need to take it to, we are people of faith, so we cannot actually take that away. People die a lot in Europe and America, but people are not dying in Africa. Are you saying it's because of our faith?
Well, the issue of people dying or not dying, well, I am a scientist.
Dr. Bassi?
Yeah, can you hear me?
Yes, I can hear you now. Go ahead. Thank you.
Yes, I said the case of people dying or not dying, I can assure you that we are beginning to receive statistics and data from the US and the Europe, and some other developed countries. And the fatality to, survival ratio is not as bad as, was earlier speculated. In fact, in some documents that we have now, I'm saying this not to give people some false hope, but at least to give some people reassurance, is that the fatality or the mortality compared to people who survive in this COVID-19 appears to have a better picture than even the common flu or influenza. So for them, they have done more tests. The number of people that have been tested in their population is far, far higher than what we have in Africa. And as such, it may look, in terms of numeracy, in terms of numbers, may look or appear that they have more deaths out there, but they've tested more cases. So the more you test, like we keep on saying, the more you see, the more you get. And so it's expected, you can imagine in New York, for example, you don't want to look at the population of New York, even vis-a-vis Nigeria. And imagine the proportion of people that have been tested in New York. That's quite a large chunk of people in terms of numbers. So we also expect that the more you test, the more you get, and also the greater will be the mortality or fatality, as the case may be. So it's not as if the numbers of deaths, in Africa compared to US. We may not be able to say that now until Africa has been able to do substantial and significant testing across its population. Then we can come out and say, okay, at the end of the day, with these statistics that we have, we can say, categorically, that the number of deaths based on the ratio, population, number of cases to, fatality, we're able to take, make significant statements and say, okay, yes, it's higher in Africa than in Europe or in the US.
Okay, I'll ask you and Sister Moji this question. I'll give each of you 90 minutes to answer. Is there a conspiracy
90
theory?
seconds, rather?
Yes, 90 seconds.
Did you say?
Is there 90 seconds? 1 minute, less than 2 minutes. Is there a conspiracy theory?
Oh, for sure. For every challenge that comes up, where medically, there's always a conspiracy theory. And in fact, if you ask me right now, based on the little research I've done and the articles I've been reading, I've tried to update myself with what is coming in. I think the theorists who feel the vaccine gains, that theory is very, very high, because maybe one of these days I may send to us one of these. It's online, actually, something that is viral, it's everywhere. The California doctors who have been able to bring out statistics, even in New York, where you have the highest index or indices of this challenge, you find out that millions, and so it's looking as if it was a case of much ado about nothing, or people wanted to create an impression at the end of the day to maybe create a vaccine that they'll be able to make for commercial gain, or that's the way I say. So the conspiracy theory, if you ask me, for sure, it's there.
Mr. Moji, is there a conspiracy theory?
Well, just like Dr. Bassi says, there are so many conspiracy theories. Another thing we should also know is that human beings are mischievous. Some people, there's a lot going on. Some people, there's a conspiracy theory in the angle of politics. There's a conspiracy theory in the angle of, on the health angle. Everything, people are just being funny. But the most important thing is, are those theories right? Are those theories true? We have access to a lot of information, but we should be careful what kind of information we are giving our attention to. We should be able to read, research, and even ask ourselves very pertinent questions. You know, be able to analyze. We all have the capabilities to analyze information that comes to us. So yeah, there's so many conspiracy theories, but how many of them are actually true? And the truth of this, why even bother ourselves with conspiracy theories? You know, if a lie goes on for 1,000 years, some Yoruba people say, one day the truth will come out. So why bother ourselves with conspiracy theories? Let's find a way out. Let's work with ourselves and find a way out of this pandemic that we are finding ourselves into. It's good to, you know, we can pay attention to the theories, keep it at a corner of our minds with the view of finding a solution, not with the view of creating fear in the minds of people, or with the view of pulling down another nation at the expense of another one, or with the view of discrediting the ideas or the potential of another nation. We should also look at what is the good that can come out of this. When we read a theory, let's sit down, let's analyze it, let's read it through and through, let's ask ourselves some questions. You know, if it's in the science arena, we can also ask other fellow people questions. What do you think about this? And then the person gives you an objective perspective, because a lot of people are just speaking out of fear, and they're speaking. It's easier. You will notice that most people believe that the theory that brings fear. Oh, it's the end time. Oh, it's a deliberate attempt from the China's laboratory to destroy the world. Oh, it's an attempt to reduce the population of the world. What other okay, 5G. You know, and then all manner and all sorts is flying around. But what is the truth in all of this? Okay, there's a virus that is, you know, ravaging the whole world. We also know that, you know, every 100 years from history, that every 100 years there's a pandemic, there's an outbreak. So how are we going to manage it? Are we learning from the lessons of those who had the last 100 years or the last 200 years? Are we learning from the lessons of those times? Or we're just busy, you know, spreading information and putting fear in the hearts of people? So yes, like you asked, there are conspiracy theories, but which of them? What is the truth? And what are we to do with what we are learning?
All right, thank you. Dr. Bassi, I want to come back to you. And now we need to begin to provide the information. All I've been doing is to try and build up. And the first thing is there any learning from the scripture on how we can begin to live healthy? Is there any learning from the scriptures on how we can begin to live healthy now and beyond post-COVID, the lockdown?
Oh, yes. Can you hear me?
Yes, go ahead.
Okay. Oh, definitely. There are scriptures, you know, that support that God is actually interested in our health. And when we talk about health, we are talking about body, spirit, and soul. We know the popular scripture in 3 John said, I wish above all things that thou mayest prosper and be in good health, even as, you know, your soul prospers. And so it talks about that above every other thing, because first of all, even though we are spirit beings, even though we are divine beings, we are also human beings, because we need this body to actually survive, you know, and operate here on earth. So it's very important for us to take care of our bodies, because if the body is just like, you know, like I always give the example, it's like the engine of a car and the chassis of a car. If the engine is good and the chassis, which is the body, is bad, that car is a bad car. And also, if you also have a bad engine and also the chassis is bad, that also makes it a bad car. So God actually wants us, body, spirit, and soul, we must ensure that it prospers. And the Bible also tells us that our bodies, that should be 1 Corinthians, I think that's chapter 6, is a temple of God. Is it 6 or 16? Is a temple of God. This is where the Spirit of God dwells. So God also needs our bodies. The Spirit of God needs our bodies to operate. And we must ensure that we keep our bodies in the best of health conditions. You know, and even in the secular parlance, they'll tell you that cleanliness is next to godliness. And if you look around, actually, the healthiest countries are the wealthiest countries. And so there's a strong relationship, you know, with scripture with regards to how to keep our health and maintain our health. The Bible also says that it wishes that we know that with long life, it will satisfy us. And that's talking about our earthly life. And our earthly life has a strong thing to do with how we maintain our bodies. Thank you.
Okay, thank you. So you have mentioned the Bible talks about healthy life. Now, I want specific. What do we advise the brethren to begin to do from now?
All right. Is it with regards to COVID-19 or generally health-wise?
We will start with
No.
COVID-19 and then we'll move on to general health. But at least let's start with COVID-19, the one that is in the front burner. Then we move forward from there.
All right. So with regards to our health and COVID-19, the message is everywhere, in every nook, in every corner. They have been ringing it in the radio stations, televisions, online and offline. And that is personal hygiene, self-hygiene, self-preservation. And for us today, with regards to this COVID-19, one of the first things we are looking at as much as possible, we are talking about an encouraging hand washing. And it's not just enough to wash your hands. You must wash your hands for at least 20 seconds. The prescription is wash frequently. As far as we have water and soap is actually the best way, because the droplets we are talking about with regards to this COVID-19, they can remain in surfaces from a few hours to days. And so as much as possible, we are encouraged to ensure hand washing. If you come to my house now, before you come in, can you hear me?
Yes, go ahead. We are listening to you.
Okay, before you come into the house, we will see the front of, we have a toilet in there. We encourage you to go there. First of all, you wash your hands. Very, very important. And then, so wash hands regularly, something we learned right from nursery primary school. And so we have to revisit this, this cultural and social habits, washing of hands. Because this virus, the droplets can actually remain in surface of our hands. And if your hands make contact with your face or your nose, that could be a challenge. Then secondly, as much as possible, avoid hand-to-face contact as much as possible. Avoid hand-to-face contact that we have talked about. For the use of the face mask, why we encourage use of the face mask is because people who are symptomatic, they can transmit, this infection through these air droplets, and so we encourage that at least with the face mask, you reduce, for the person who is actually infected, you reduce the chances of transmitting these viral droplets, to some other person. And then also, you also realize that because this particular COVID-19, it has a long incubation period. The incubation period talks about the period where the virus is replicating, increasing in numbers in the host organism, in this case, in the human being. For that period, it's about close to 14 days, 2 weeks. And so you see this is a long incubation period compared to some other acute respiratory syndrome viruses. This is quite very, very long, 14 days. So within these 14 days, you can find out that somebody who is, pre-symptomatic or who is symptomatic can actually infect another person. So when you go to crowded areas, the market, the stores, is that okay? Maybe they have to review this lockdown. We are encouraged to put on our face mask to avoid somebody who is symptomatic or somebody who is, because even if the person is not symptomatic, if it's pre-symptomatic, as in before it begins to show obvious symptoms, the person can transmit it. Within 2 days before symptoms onset, you can have those transmissions. So as much about you protect yourself. Is that okay? So we have talked about personal hygiene. Also, in terms of health, personal health, we encourage people this season and this period to do what we call respiratory hygiene. As much as possible, do the breathe in, breathe out exercises, because we know that this particular virus has a, it has a love, for the respiratory tract. It has an attention. The respiratory tract actually is favorite tract where it tends to actually show most of its negative effects or consequences. So try breathing exercises, just in and out. Those things are things we did even before COVID-19. We used to do it in nursery school, primary school, and then try and get fresh air. I also encourage us we should reduce, the air conditioning, remaining in tight rooms in which you just have air conditions up and down, all through for most days, most hours of the day. As much as possible, reduce the number of times, that you have to stay within the air conditioning system. As much as possible, encourage, the atmospheric, the normal, open your windows, the window ventilation and all of that. And so, because we also know that there's a relationship between temperature and, the infectivity of this particular virus. And then the surfaces that people touch a lot, handles of the doors and all of that, as much as possible, we're encouraged to disinfect them. Is that okay? There are many, we can clean them. We clean them as often as possible, as often as we remember. Just keep on cleaning them. Tables, even our cars. When we take our cars outside to the marketplaces, if you come back as much as possible, wash those, wash those, wash the cars. Use detergents and clean them, in and out. You don't know who has placed his hands on top of your cars and all of that. All those things are some measures you take. And then with regards to, it's not enough to actually wear those face masks. As much as possible, please, if it is a disposable face mask, the one they use in the hospitals, we are not advised to reuse them. It's a once for all usage. But the ones that they are sewing using, materials and all of that, those ones, maybe you can take them up and then wash them, sun dry them very, very well. Thank God we have not gone into the depth of the rainy season. Make sure that it's sun dried and make sure it's dried, then you can reuse them. But for the surgical masks, don't just dispose them outside. Please, let us not just dispose them or litter them. Once you have used it, then don't use your hand. If you want to talk to somebody, remove the face mask and then talk and fix it back. That's very dangerous. You may be introducing, the viral droplets, into the system. Because as much as your hand can actually touch the inner aspects of the face mask, you are increasing your susceptibility for transmission of this disease. So please, as much as you want to adjust face masks, adjust them, at the strings and the strands that are adjust by the side of the ears. And if you are bringing them out also, you do that same way. Don't use your hand to bring out the face mask. Use your, the strands at the side. Bring them out and then you can dispose them for the disposable ones. And for the ones that you need to wash, you wash them very well. Use detergents and then sun dry them and then make sure that they are clean. And so that's for COVID-19. So basically, that's just it, I'm sure Sister Moji would have some other things to actually, add. Of course, at the background of this, for any illness at all, if your immunity is actually the primary thing. Viruses, if you look at the story with regards to viruses, scientific stories, their fatality rates, normally, and mortality rate is not as bad as some other microorganisms. Because all what they do is that they just need a host body to replicate, to multiply and increase. But in terms of fatality and mortality, it's not as bad. But the challenge is if the host organism, if your immunity is low, then you have a higher chance of having, complications from that viral organism. Viral organisms, they're just looking for a medium to multiply. But if the medium where they find themselves, the immunity is low, your resistance is low, it's going to be a challenge. And how do you build up a resistance? It depends on your dietary lifestyle, the things you eat. It's not a time to be eating junk food now. It's a time to eat foods that will actually build your system. It's a time to be eating food that will build your immunity. And so you eat foods that are rich in vitamins, eat foods, that can help, to give you the required calories for the day. Don't overfeed and don't underfeed at the end of the day. I believe we have in all the fruits, we have enough, multivitamins and what have you. People don't really know why vitamins are important. Vitamins are important, outside, for your immune response. For your enzyme, the enzymes in the body requires vitamins as coenzymes for them to perform. If you don't have enough vitamins, if you don't have the vitamins are important, your enzymes cannot work. Most of them serve as coenzymes, that they cooperate or help the enzymes to actually function appropriately. In that way, of course, vitamin C, vitamin D, and as much as possible to please this season, you can just stay outside and get exposed to the sun. Is that okay? Because vitamin D is also very important. Locking up yourself. Actually, there are scientific materials to show that people who actually lock up themselves in the house, who maintain sedentary lifestyle, have we talk about stay at home, stay home, and all of that. There's a tendency to actually have a compromised immunity, as in your immunity will reduce. There are papers to actually suggest that people who stay indoors, and then of course, this also brings on the issue of bodily exercise. Just we're not saying there's a given age you get to. If you are 40 years of age, I may not advise to do jogging or whatever, but you can just walk, brisk walking for 30 minutes for most days of the week, 3 out of 4. Just walk around your estate or walk around, is that okay? Maintain the social distancing. As you do that, you are releasing some, hormones. The hormones they call endorphins. We call them feel good or make good hormones. They give you a feeling of, of satiety, as in just And it helps to boost your immunity. It helps to boost your immunity. And so these are just a few things I have to say. I'm sure Sister Moji would also have some other things to add. Thank you.
All right. Thank you so much, Dr. Bassi. That's very wonderful information that you provided. Now, Sister Moji, I just want to ask, as Dr. Bassi said, and we've been hearing that this virus attacks your immune system. And we've said eat good food, but we know the economy. There are a lot of people who can't afford, okay, the basic staple. All they have is maybe I just want to eat rice, or I just want to eat gari, or I can only afford beans, okay? And they say fruits are expensive. But I want to ask you, as a pharmacist, what are some of the drugs that people should have available handy that are not expensive, that maybe you can act as supplements or things that people need to have available to be able to boost their immune system? Secondly, the symptoms of this COVID-19 are almost similar to some other diseases that we face here in Nigeria. So one could be having, a doctor friend of mine always says that, look, when you have headache and you go to the hospital, that without even conducting lab, they need to treat you for malaria first, because every Nigerian has malaria parasite in them. That's what he usually tells me. Okay, that before waiting for the lab results to come, the first thing is, can we just check for malaria? And now they are saying, if you have high fever, do not take ibuprofen and so on. So what are some of the drugs that people need to have, either as supplements or things to take care of themselves while they're at home? Because we can't go to the hospitals. They say, do not go to the hospitals except you're exhibiting those symptoms, so that you don't go and endanger the lives of the healthcare providers. So what can we do while at home in case children are sick, in case adults are sick? What can they do? Thank you.
Thank you very much, Brother Vincent. Now, when we go to talk about drugs that we can use, you just talked about things being hard, people don't have enough to eat, and then they might not be able to eat properly. But let me just state, first of all, categorically, that it's cheaper to eat healthier than to be buying medication. Now, you probably wouldn't hear that from your community pharmacist, because your community pharmacist also wants to make sales and wants to have an impact in the community. But the truth is that it's actually cheaper to eat healthier than to actually go on medications. Now, you can eat, just like has been said, we might not have so much money. What we have are the staples at home, like the rice and the beans and the yam. But just adding vegetable, which you can buy 100 naira, ugu leaves, or probably just buy orange, 100 naira. Share, if you have 3 children, probably just buy 2, share it amongst them. Just little things like that. Fruits, if it's a banana, a banana is a bit on the expensive side, but there are fruits that are in season that are not expensive. Like now, I know we have mangoes. Mangoes are in season. Oranges, not so much. The oranges that we have do not have so much water, but I see pineapple, I see cashew. Cashew is in season now. So just your 100 naira fruits, and then make sure that you get, just like Dr. Bassi has said, there are a lot of vitamins that we can get from these fruits. We don't have to go as expensive as that, because if I now want to start talking about medications that we can take apart from the vitamin C, I remember the last time I did speak that we probably need, if you can, go on multivitamins. And we have so many nutraceuticals out there, so many companies selling all manner. I don't want to start advertising for them, but we have so many, all those network marketing companies, what they are selling, and their drugs actually work, but their medications, they will tell you they are not medications, but they're actually medications. They are on the high side. They are actually expensive. So that's not what you would, it's only if you can afford it, because they actually do work. Yes, they are effective, but they are expensive. So if you can afford it, you can go on all those nutraceuticals just to boost your immunity. But on the cheaper side, the cheaper thing that you can do is to keep yourself going on our basic food, the ugu, the green, the green vegetables, cucumber, or when you're cooking your stew, just grate a little bit of ginger. If your husband or the wife can tolerate garlic in food, just grate a little bit into the stew when you're making stew. Because I know of course, it doesn't go with our soups, but it can go in the stews. when you're cooking jollof rice, or even if it's a oil rice, you know, just for flavor, grate a little bit of ginger, grate a little bit of garlic, squeeze lime, you know, all those things, you get your nutrients back. You get your nutrients, you're eating a balanced diet. So you don't really need to spend so much to eat healthy. It's when we now talk of going on the medication side that definitely you're going to spend money, because all those nutraceuticals are, like I said, are on the high side. Thank you.
All right. Thank you so much for that very wonderful explanation that you've given. Now, I just want to ask, maybe I should ask Dr. Bassi. What we are seeing is that, and NCDC and the task force team are coming out to say that the people who have been dying, most of the people who have been dying, have underlying health challenges. And we know in Nigeria, the challenges that we have is people do not take their health seriously. So before people actually go to the hospital, it's been maybe you're going on admission. You're a doctor. What can you advise? And someone can be there and they do not know that they have the underlying health challenges. So how can people like that keep themselves safe? Because in case they contract the virus and get the disease, what then can they do? Because we've seen situations where in some states, they are saying everybody that died had diabetes. Some had, typically, I think diabetic patients would have issues when you contract that virus. So please, what then do we do for people who maybe know that they are asthmatic, they are diabetic? How then can those kind of people protect themselves? Because we do have members of our church who are in the south. In southern Nigeria, there's a lot of rainfall and they're entering the seasons where if you're asthmatic, you know, you're prone to have attacks. So then how can people like that manage their health? Thank you.
Can you hear me?
Yes, yes.
All right. Thank you for that question. Well, first of all, I would like to start by saying that all over the world, the health management is geared towards prevention now. And that means prevention is better than cure. And it's something we have heard, or we have heard even as, you know, little children growing up, we heard prevention is better than cure. I'll come to your main core questions. First of all, let me start from the prevention first of all, and then I'll now talk about people, like you said, most of the people who fall into the 5 to 10%, you know, mortality rates are people who have underlying conditions like cardiovascular challenges, hypertension, heart disease. People will have challenges like diabetes, you understand, and people have respiratory challenges, asthma, or some immune disorders.
Yeah.
People are immunocompromised, HIV, you know, and maybe liver diseases, chronic liver diseases. People have chronic kidney disease. Those are the kind of people, or the categories of people, that when they have this infection, like I said, because their immunities are low, the virus just uses the opportunity, you know, it's like an elephant that falls to the ground. Under normal circumstances, the no-born ant well to actually, you know, because of this low immunity, the virus is opportunity, you know, to attack them and then to bring them, you know, and then it can cause death or complications, which if not properly managed can cause to death. So, but first of all, when we talk about health, and this is not, and I share this with colleagues. First of all, with regards to health, the first thing is education. The doctor needs to educate his patients, and the patient also needs to educate themselves. You can go online. There's hardly anything you can see on Google nowadays, or even on YouTube, in terms of, you know, advice on best health practices, you know, personal hygiene, personal self-care, all of that. So educate yourself. Arm yourself with information. It's very, very important. Is that okay? So education is very important. The next step with regards to health, you know, under that education too, there are two things you'll be looking at. First of all is dietary lifestyle. Is that okay? And exercise. Dietary lifestyle is very important. We can't say too much about it. I always say that your dietary lifestyle is what determines your lifespan. Is that okay? Someone said of all the rules that God gave in the Garden of Eden with regards to man, the rule had to do with what we eat. You know, what we eat actually determines how long we live, and that's the truth. We cannot hide from that. So let us learn, first of all, with regards to our health, so that we cannot, for those who have not actually fall into the categories of people with what we call non-communicable diseases, or the diseases I mentioned earlier, as much as possible, watch what you eat. There are things you can't eat when you get to certain ages, age brackets. Exactly. We talk about, the dangerous, the whites, but just if you go online or ask your your family doctor, they can actually give you an example of things like salt, white bread, is that okay? Red meat, and the junks, carbonated drinks, and all those artificial foods. Those are things we should not leverage on. Unfortunately, in Nigeria now, we are seeing many of the things that are coming in terms of food. Everything is now grown, everything is now fertilized. Everything, the fish we eat even in Abuja here, they use a lot of fertilizer, a lot of chemicals. We should go as far as, asking people, where did you rear these things? Is that okay? Where do you get your stuff from? You remember once we were talking about even apples that they bring in. It's good to eat apples, but how are they stored? How are they transported from the points of production to the retailers? Is that okay? So you educate yourself on these things and then go online. As much as possible, let us eat meals that are alkaline based. We did, primary, integrated science or elementary science. The foods or the fruits we should be eating are fruits that are within the alkaline region, within pH of 7 and 14. Is that okay? Because acidic conditions, most enzymes function within these alkaline conditions, and if the conditions are acidic, they may not function well. Most of the bodies, even the blood pH is in the alkaline, neutral alkaline side, 7.2H to 7.45. The blood, for it to function effectively, it must be on the alkaline side. So any meal or any food you take that tends to drift or drag the pH of the body towards the acidic side puts the body in danger and tends to affect the immunity. And so we go on, so education is very important. Then you go and look at exercise. We have said it's about burning in terms of diet, before I finish diet, you don't just have to, you eat, we say we eat to live, we don't live to eat. And so you begin to ask yourself what amount, you can even Google it, what calories of energy do I need in a day, to function very well. You don't need to just keep on loading yourself and all of that. Still talking about diets, as much as possible, avoid eating beyond 6 p.m. We talk about that. Is that okay? Just eat, eat good foods and then eat moderately. Is that right? Yeah. And then, so that is, of course, I cannot exhaust that. Then for exercise, even the scripture tells us that bodily exercise profited little. Bodily exercise profited little. And that's very, very important. We must exercise ourselves. Just mild exercise. If you are 40 and above, like I said, I don't encourage you to start jogging and doing rigorous exercise and what have you. Just open air exercise, which is what I encourage. If you cannot afford the gym, you don't have to afford the gym. It's even better to even do open air, where you're just walking or strolling on the street. It's a better form of exercise. It helps your ventilation. It helps, your respiration and what have you. You are taking in fresh air rather than taking air in an enclosed system, which may not be as pure as, as the air that you have outside there. And so as much as possible, you do those exercises. They help in improving, blood circulation. Is that okay? They also help in improving your muscle tone, help, your heart muscle and all of that. Is that okay? And put all your body in the front. And you can actually Google this information and see the kind of exercises. If you are younger, of course, you can involve yourself in many exercises, swimming, football, basketball, and all of that. And so we can all that. But the bad thing is that we are told that we should be able to, exercise 30 minutes, for most days of the week. That means at least 4 days out of 7 days. And so you discipline yourself. You discipline yourself. Paul said, I put my body under. Putting my body under also means that my appetite, I must be able to control it. Is that okay? Is that everything that comes to the table that you eat? Self-discipline is very important, in preventive health. All right. So that's okay. So, and now whether you are young or whether you are old, you must know what you call know your numbers. Know your numbers. What we mean by know your numbers, at least it doesn't cost you anything. Like I keep on saying, it would be stupid of anybody to drive a car for 40, you can't even do it self, to drive a car for 30, 40 years or 25 years, and you have never been to the mechanic and say, please change my oil. Is that okay? Look at the, look at the, what do you call it? Look at the oil. Is that okay? Help me change the oil and all of that. You look at the tires, look at all of that. You go for a checkup, go for medical check. There's some basic things you can do. Just a urine analysis, very simple. Urine analysis, you can do it in some centers, 200 naira, 500 naira general hospitals, can show you about 20 parameters that can give you an indicator of what's happening in your body. Check your blood pressure. Check your blood pressure. What does it take to check your blood pressure? It takes nothing. It just takes effort of going to a center or a pharmacy and say, please, can you help me check my blood pressure? Or you can even buy the apparatus, you know, when you're at least 25 or 30 and 40 and above. If you look at the WHO definition of hypertension, it's from 16 years of age. So nobody can actually say, oh, I'm too young or too old for that. So you check your number. Some people say, I came to this man, he has not been to the hospital before, and he's arriving at the hospital with a stroke at 40 years of age or 35 years. We have seen that happen over and over again because this person was not checking his numbers. Check your, when the Bible, I said the Bible, nursing care talks about it called vital signs. Vital, that's very important signs. They may look stupid, but they are very vital. Temperature, your pulse rate, your heart rate. Is that okay? Yeah. Your oxygen saturation. Some very simple minor things. Those are the things you keep on checking because it gives you a picture of whether you are doing well or whether you should be cautious. Is that okay? And then also ask questions that from your parents, if your parents are still alive, or your uncles or relatives. Are there challenges that run through the family illnesses, family histories of cancers, of different types? And you ask yourself, and then so you begin to moderate yourself, and then be careful with the kind of things that enter into your mouth. So that also falls into education and all of that. So we check our numbers. Now, for those who have the challenges currently, for now, hospitals are red zones. They are red COVID-19 zones, such that entering there is a risk. Is actually a risk for those people who have these challenges I mentioned earlier. Maybe I should mention them again: high blood pressure, hypertension, diabetes mellitus, heart diseases, chronic kidney diseases, chronic liver diseases, and immunosuppressive conditions, HIV, underlying HIV conditions, and people with even respiratory tract challenges, bronchial asthma, or any of the respiratory tract challenges. Is that okay? And so fibrosis of the lungs and all of that. Those kind of people, as much as well, limit your going to the hospital. You can get your drugs, from the pharmacy, or you can send somebody to go and buy your drugs. You can call your doctor, and now online consultations are going on. Is that okay? And online prescriptions are going. Ask your doctor, please, my drugs is over. Please, can you just send me a prescription and what have you? And you send somebody at home to go to the pharmacy who is not, having these challenges, or you can even go to the hospital to get your drugs for you. Is that okay? Or you can even so that's the way that's the way we go. So as much as we'll keep, and then of course, whatever we said for those who are trying to prevent having these challenges also goes for those who have the challenge. Of course, you have to be more disciplined with regards to that. Your dietary lifestyle, your exercise lifestyle, you educate yourself, and then more importantly, very very important, don't register fear. Fear even kills faster than any of these challenges I mentioned. And so as much as possible, try to harm yourself with your association, people you associate yourself with. Are there people that can create a positive atmosphere around you? The news you listen to, does it create a positive energy around your negative energy? It's very, very important because fear releases, certain kind of hormones that can also, depress your immunity. And so if you live in fear, you're already opening the door for death. And so as much as possible, arm yourself, read books, is that okay? Listen to tapes, listen to songs, that can lift up your spirits. And, the Bible says when a man's spirit is down in time of adversity, there's a problem. But the spirit will actually bear him in the time of adversity. So you try to bring things that can enliven your spirit. Stop listening to negative news. Listen to positive news. Paul puts it this way in Philippians chapter 4, verse 6. He said, those things that are true, those things that are honest, those things that are just, those that have good reports, if there's any virtue in it, is that okay? If there's anything attractive about it, if it is true, if it is a good report, stop listening to false reports or negative reports. That's very important, to build up what we call, Ed Pastor talks about spiritual immunity. Very, very important, in remaining healthy and, prolonging our lives. I think those are just a few of the things I'd like to say with regards to our health, preventive-wise, and, and managing conditions with regards to COVID-19. Thank you very much.
Thank you so much. Thank you so much, Doctor. So we just want to take one question from one of the participants we have joining us. So I'm going to allow Team Hermon to ask this question.
Okay. Good evening, everyone. Hello.
We see you. Go ahead. Hello? Ask your question.
Good evening. Good evening.
Okay. I liked all that Dr. Basi have said. It has been very enlightening. But one of the things I keep thinking is after the COVID-19 or after the lockdown, I understand that the virus, the transmission will still go on, even if it's not on the high side, but somehow people will still carry it and they're still transmitting it. And you need to go to the market. And recently, because when you see the crowd in the market, each of these days, like this lockdown period, that the markets are open, when you see the crowd, you know that it's a serious issue, because people are not observing the 1 meter distance or face masks or whatever, or hand sanitizer and all that. People are just busy exchanging money, touching each other here and there. Even people you don't know will just push you, and when you scream or you try to be the one to talk about social distancing, you look as if what's wrong with this person. I had an experience. I was going somewhere. I have to park my car to get it washed. So, but I needed to go somewhere else. So, when I decided to take a public transport. So, in my car, I have a face mask, and I have hand sanitizer, and I have disposable gloves. So, I decided to carry the disposable gloves and the face mask and put them on. And as soon as I entered the vehicle, it was like they started, you could hear these people, they would tire. It was even the owner of the vehicle, that is the driver, was the first to start talking about making jests of me. But I just kept quiet, because I think I don't need to go into argument with them. I just kept quiet. But if I wasn't who I was, that would have created a friction between me, them, and 2 other men that joined the vehicle. Funny enough, there's a lady that was behind, because I have to tell them that I'll sit at the front, I'll pay, nobody comes in. So, but what am I trying to say? The stigmatization when you try to do the right thing, what you are taught to do to prevent this. And if you are not someone who is not hot temper, who is not patient, as it were, you could have problem with people because you want to do the right thing. And somehow you could just decide to just boss, well, okay, I'm no more interested. Let me just go like every other person. So in such situation, what do you do? Then 2, another scenario, you like for me, 1, I go to the dentist every 3 months, every 6 months. Now, and I understand that this is a disease. One place the attack is the lungs. And your dentist, what they do is that they open your mouth, maybe they want to clean it up, they want to do all of that. You don't know you don't know the level of the sterilization of those equipment. You can't say this, because they'll just tell you they've done it and they start using it. So what do you do in that case? Do you stop going to the dental clinic? You just suspend all of these, suspend going to the market, suspend entering the public transport, because you can't cope with the people reaction, because the people will react as if something is wrong with you. I've seen it before, and I know, and I imagine if somebody who is not very patient in such a situation, what would that person do? So that's my question.
All right, thank you so much, Pastor Tim. So I would allow.
Can we quickly answer that so that we wrap up?
I will allow Sister Moji to answer that question.
To unmute me. Okay. Thank you very much. It is obvious already that life is not going to go back to the same even after this pandemic. That is one thing that is definitely sure. Things are not going to go back to the status quo. And so a lot of changes are going to be expected. And we should also expect a lot of changes after the pandemic. Now, you made the description of the marketplaces. I think one thing that I wanted to say after Dr. Bassi spoke was that please don't go out until you absolutely need to go out. We are going to have to restrict our movements and restrict the way we go about our businesses. A lot of things are definitely going to change. You only go to the market when you need to go to the market, do whatever it is that you need to do, sharp, within a short space of time, and get out of there. Limits. I know it's a market and there's a lot of shoving and pushing around, but you can stand by the side, quickly do whatever it is that you need to do, get out. As you come back home, observe all the prevention practices that Dr. Bassi spoke about. Wash yourself, remove your clothes, keep your clothes in one side, and life goes on. We can't take things for granted anymore. About the issue of stigma that you also spoke about, you know what is right. It is true that some people don't believe that the virus actually exists. They don't understand the severity of what the virus can actually cause. But that does not remove from the virulent nature of the virus. The virus is still a deadly virus, and whether we believe it or not, whether we take the precaution, if we do not take those precautions, it would escalate. Now, what you need to do, what we need to do, is to first of all protect ourselves and educate people as much as possible. If they make jest of us, the fact still remains that we have done our part. Try that. Don't change your stand, because if the fact that people don't believe that it exists does not remove from the virulent nature of the virus. So that is just it. So we need as much, just like the government is doing a lot of awareness, creating awareness, we also need to, as individuals, to also create our own awareness. Because if we don't create that awareness, we're going to go back to status quo. If care is not taken when the curve has been flattened, if care is not taken and we do not continue these prevention practices, it is going to have a second surge, and the incidence is going to escalate again beyond, I don't know, because people are already talking about there's a first surge and there's always a second surge, that the second surge comes up when we relax our measures and people take things for granted, and then the virus comes back into the population and it starts to wreak havoc in the population just because we do not take precautions. So we do need to take precautions. You talked about going to the dentist. Practices are going to change even after this pandemic. Once they open the doors and say, okay, you can go out, you can go back to your offices, a lot of offices are already re-strategizing. Like for instance, in my office, we're already making plans to ensure that we do not have more than one contact with pharmacists whenever they need to come and register. So a lot of practices are going to change. I'm sure in the dental clinic or in the dental hospital, more preventive measures are going to be taken. More stringent measures are going to be taken. And so we need to be able to trust our medical health practitioners and also ensure, you can even ask questions. Sir, have those instruments been sterilized? Sir, you have not washed your hands before coming near me. Sir, please keep your mask on. Because, everybody has to be on their toes, try as politely as possible to ensure that your rights as a patient are being preserved. And so that is it. A lot of practices are going to change. Whether people take their precaution measures or not is what is going to determine whether we're going to flatten this curve or whether the curve is not going to be flattened. Thank you.
Wow, I want to sincerely appreciate every one of us. Time is not on our side. We've exceeded our plan for today. But I want to assure us that we will still come back to health sometimes next week. And I want to thank every member of the panel, Dr. Bassi, Sister Moji, and also Dr. Joe, even though he couldn't make it. Thank you so much. For our audience participant, Brother Shegun, Brother Tim, Sister, I know your name, I'm trying to remember your name. Thank you so much, Brother Vincent. Thank you. We'll see us on Friday by 6 p.m. where we'll host another section. I want to believe that it's been a blessing. To be honest, we did not finish all that we have to discuss, and we'll have another health section by next week. So I'm sure that when we call upon your resource persons, you'll also be available. Please, if you have any other question, put it on the chat or send it to us via the WhatsApp. We'll answer it. I have a woman who says here, how can women go to market sharp? We'll answer that when we meet some other time. Thank you, good night, and see you next week.